providing the Bellin experience through patient and family-centered care, listening and honoring patient perspectives and choices, and working collaboratively. These are all reflective of the value of service. And service was the driving principle as Bellin's Food and Nutrition Services team designed and successfully implemented a new food service plan for patients. That's why they are this year's recipients of the Bellin Values in Practice Team Award winner for service. Mention hospital food and many people will groan, but that's not the case at Bellin Health. Thanks to the new room service model, patient satisfaction is up, food waste is down, and the team at Food and Nutrition Services is re-energized.
The way that Bellin Health had been delivering food to our patients was a process that was over 40 years old. We recognized that there was not only a great deal of waste with it, but it also did not lead to the satisfaction of our patients. So in making the change and making the huge redesign effort that we did, we went to a room service model.
The room service delivery method is like a restaurant service. So you have a bigger expanded menu and you can get anything on it every day. And it gives the patients a lot more choice. It gives them the opportunity to order what they want, when they want it. So we're delivering food all day long now rather than just 3 times a day. Our process for redesign took about a year. We built a new room service cooking line in our kitchen and took out all the old equipment and brought in all new equipment.
Over half of the team had to relearn their jobs. If you can imagine that cooks had to relearn how to cook because room service requires a cooking style that's more like a restaurant. The individuals who would merely take the trays and leave them in a cart for others to deliver were actually taking those trays now and bringing them to the patient's bedside. That was a huge change for them. In addition to that, we introduced a whole call center. These are individuals who are specially trained to not only listen to the needs and the wants of the patients, but then also talk to them about what they can have within their diets and then help them to choose the best and healthiest choices.
I had to change a lot of the way I did things. I had to learn a lot. I've never really worked on a grill like that before, so that took a lot. Just pretty much learning everything pretty much all over again.
I definitely had to get better at customer service and smiling, even though I tend to smile often. Being a little better at communicating with patients and finding out their needs, their wants.
In the old method of food production, we knew on average per year we were throwing away around $70,000 worth of food because it was food that was pushed out that patients weren't in their rooms for or they didn't want. After going to the room service delivery, we saw the plates and the trays coming back pretty much empty, which was a huge satisfaction for the team, and obviously that meant that the patients got the nourishment they needed.
Patients are loving their food. They're able to get a lot more than before. Their food is being delivered hot, and they're able to get it whenever they want it.
Congratulations, everybody, all my coworkers. I know everybody worked really hard to get this up and running.
I would like to congratulate the Food and Nutrition team on winning the award for team service. They really deserve it, and they really did everything above and beyond, and we knocked it out of the park, and I'm so proud of them.